Welcome to Truckee Talks. If you've been reading the papers in the last few months, or perhaps if you've visited your doctor's office, you'll know that many local physicians are starting to drop coverage with Blue Shield insurance. This has been a concern for lots of people who count on this insurance coverage to help them with their annual medical bills. And with us today is a group of panelists going to discuss that, perhaps why it's happening and some things that we can do to help correct that or remedies we can use to get through it. First with us is Dr. Chris Richards. Dr. Richards is the president of the Independent Practice Association. It's nice to have you here, Chris.
Thank you, Matt.
Carolyn Minnick with HRH Insurance.
Hi.
Carolyn, nice to have you here.
Thanks.
Rob Eskridge. Rob is a member of the Board of Directors for Tahoe Forest Hospital.
Hello, Maya.
Rob, welcome to the show. And finally, Karen Lynch with HRH Insurance.
Thanks
Karen,
for having us, Maya.
nice to have you here, and nice to have all of you here. This is a big deal. Chris, first of all, why is this happening? Why are physicians starting to drop Blue Shield?
Well, I think there's a couple factors going, and it's not starting. I think there's an attrition that you've seen over the years with Blue Shield, but it is for the common reason that you're inquiring about. I believe that Blue Shield is probably not fulfilling their mission of paying for medical care, and through their policies and their payment methodologies, physicians are making their own decisions about what sort of payment they can live with, and I think it boils down to a simple matter of Blue Shield has decided not to pay what a doctor needs to get paid to continue in business, as any business would make that kind of decision. You have to set a fee that keeps you going.
Now, I should mention, too, that our producer spoke with Tom Gwynn, who is the Vice President of Public Affairs for Blue Shield, and he was invited to be on the show today, and we had not heard back from him, so we carry on without him. Chris, I'm going to try to say this without sounding particularly rude, but there are some out in the citizenry who are saying, look, it's just a bunch of greedy doctors who are charging way too much, and I need my insurance coverage. How do you address that?
Well, I think that is a common problem over the last few decades. There is a perception of doctor greed. I also think that there's another side to that coin, which is people, as they access our services for their health care, are going through the intermediary to pay our bill. And so it disconnects them from the relationship with the doctor. They're separating the financial arrangement with the business of being a doctor, and they're enjoying the medical relationship. But they've got the two separated in such a way that they feel that they're entitled to whatever they need. And of course, we would like to provide whatever a person needs, and we will no matter what the payer situation is. But we still do have to get paid to take home the bacon and live in this community.
Like any other business would.
That's true. And it is an unfortunate image that medicine has accumulated over the last few decades of the greedy doctor. And I can't really fight that image, and I understand how that works. Personally, I don't see physicians driving the fancy cars and living the high lifestyle that I think people imagine us.
Carolyn and Karen, you're seeing this from maybe from the client or the patient's other viewpoint. They're coming to you saying, I need insurance, and either I can't afford it or it's not being carried by my physician. Give us some feedback on that.
Well, I think traditionally Blue Shield in our community has been a widely accepted plan, and it also has been affordable, which I'm sure Karen will agree to. And for years, the physicians told their patients when they came in to be treated, oh, we accept Blue Shield, or we accept another type of plan, something that may be contracted with, let's say, the St. Mary's Network out of Reno. And so when the consumer came to us, they said, is this one of the plans you offer? And certainly we're going to show them that, along with the other variety of plans that we have. And now that the attrition has happened with Blue Shield, and there's some lag on getting additional contracts with new carriers and new PPO networks set up, it creates a real void in the market, and that's the effect that we're seeing.
Karen, how do you reach out to physicians in the community and say, my customers, my clients are looking for this product, and we need you to cooperate with us on this product? What kind of communication goes on between the insurance brokers and the physicians?
I think education on both parts. A person that applies for a health plan needs to understand the parameters of the health plan, needs to be educated what type of health plans are available, which is why we present several different health plans to people and then allow them to select a plan that's good for them or their family. But the doctors also need to be educated to what the community needs. Do they need something with high deductibles or low copays or, you know, whatever? And I think I would have to somewhat disagree with the perception of, I don't think the town looks at greedy doctors, but I think they certainly look at a different type of lifestyle that you're living versus to somebody that's trying to make ends dramatically meet for them, and then be continuing to ask to go to a different health plan that costs more so that you can make more money. You know, I think that the community needs to be satisfied that you've done your best to analyze your business as we do our own personal budgets. Have I got the best staffing? Have I negotiated the best rent that I can for my business? Do I have an efficient billing system? Am I operating on the peak of efficiency so that I don't have to have a San Francisco lifestyle but can maintain at a level of income that is comparable to people in Truckee?
I'd like to have Dr. Richards respond to that. Before we do, though, Rob, the Tahoe Forest Hospital is a district hospital. It's a community hospital. Citizens pay for this, basically, with taxpayer dollars. What is happening with the hospital district to bridge the gap between insurance and physicians so that we can provide care and people can afford it?
Well, Maya, our role as board members, and I serve as one of 5 publicly elected board members, our role has changed dramatically. Traditionally, the role of a hospital board member has been oversight to be sure that the hospital is financially sound and well managed. And as managed care has come to the mountain, and especially as Blue Shield has become less available, I think the role of the hospital and the board members have been to coordinate and to communicate more than ever before. From a coordination standpoint, we found many patients coming where the hospital accepted their insurance, but the doctor who treated them there didn't accept the insurance. Or in some cases, the hospital and the physician accepted the insurance, but one of the hospital-based physicians, like radiologists or anesthesiologists, didn't. So our first initiative was to coordinate as much as possible so that we knew which plans were accepted by everyone who would be paid for treating a particular patient, especially for some of the acute procedures where you do require an anesthesiologist and you need some x-rays, and those are billed separately. Those doctors don't work for the hospital, they work in the hospital setting. The second thing that we've done is have more recently become very active in understanding at a very detailed level which plans are accepted in the community, which doctors, where to buy them, and we're now gearing up a rather massive information and communication effort which will be happening within the next month or two, so that people know as the situation changes how they can get the latest information on which doctors accept which plans and which brokers in fact sell which plans.
That's going to be very helpful. I know that that's the kind of information people really need to get their hand on. And you spoke of an example a coworker of mine went through where she had to have a surgical procedure and didn't even think to ask whether or not each of the different providers would have been covered. And in fact, her anesthesiologist wasn't. And she was shocked when she received a $1,100 bill for that. And that's the kind of thing that I think those of us out in the community who really don't know that much about your business don't know what to ask, don't know where to go to get this information, and don't know the questions to ask. Before we move on, Chris, Dr. Richards, I'd like you to have an opportunity to respond to what Karen said. There are so few businesses where a client or a customer will come in and say, you're charging me too much, I think you're not running your business well, and I want you to change your business practices, instead of just going down the street and saying, I'm going to go to Joe competitor down here because he charges less. How do you address that? There is still a very, I guess, strong perception out there.
Oh no, I think people do feel the choice, that they do have choices in their providers. Maybe one way to understand their choice, and also the perception of doctors accepting, when you say doctors accepting your insurance, if people would understand, that means what you're really saying is that the doctor has agreed to have a contractual relationship with the insurance company on the insurance company's terms to accept as payment in full a certain allowed amount calculated by the insurance company, which has no relationship to your fee. You've basically agreed to discount your services. And so built into that relationship is already a discount. When you say your doctor accepts your insurance, it's a little misleading. We accept all patients, insured, uninsured, welfare, whatever. Whoever has a need gets treated. However, if you want us to accept your insurance company, that's a contractual business relationship that you do need to think about, well, what am I buying when I buy my insurance? Insurance companies would like to sell you an entire panel of physicians for you to have some choice to see, and this is what we'd like to provide, of course, choices. When the insurance company relationship is not going well, the choices become constricted or go away.
Sure, and if most of us have suffered the frustration of getting a rather huge directory from our insurance company, if you're lucky enough to be insured, for one, and kind of being heartened by the fact that you've got all these choices, and then flipping to the page that actually has Truckee listed on it and finding that your choices are minimal at best, and we need to find a way to address that.
That's a situation that occurs not just in healthcare. It occurs in purchasing a lot of things that people need to live their daily lives in Truckee, though. I mean, from wheelbarrows to jeans for your kids. So you have to make a determination if you want to do it local or go outside, or, I mean, everything you do is a freedom of choice.
That's true, although in part that choice is driven by whether or not you can afford it through your insurance company. When I get that directory and I see the list of doctors and the physician that I choose to go to because I'm comfortable with that relationship isn't on that directory, suddenly I'm faced with a very uncomfortable choice. Do I pay more than I can really afford to continue my relationship with this doctor, which I find to be a very important part of my quality of life, or do I not pay and go to somebody with whom I don't have that same level of trust or same level of care?
But most of the contracting entities that Chris is referring to, the PPO networks, and not so much in the HMO environment, but they all give you the facility, as a consumer, to take a request form to your physician and say, I'm enrolled in XYZ plan, and they use this particular network, and I'd like to sponsor you or endorse you to join this network for the purposes of being a provider, a contracted provider. And because many times the way the PPO networks work, they have a hired person who goes out and talks to physicians on a continual basis. And some of the physicians have ample time to devote to see what type of contractual relationships may be there, and sometimes they don't. They push off that responsibility to an office staff member or someone else. So I think, we maybe have one person who really is initiating the conversations with the physicians and maybe not getting necessary feedback. So you as a patient can be an advocate for your own physician and be able to say, I'd like to join this network. Will you please talk to them or investigate it? So maybe that's an added something that the consumer can do.
Yet that comes up very short when the conversation is simply with one physician, because over the course of a person's life, they're going to need treatment by
From a variety,
of physicians, and that's where the information piece comes in, is understanding, are you going to need care for your children? Are you going to need care in a surgical setting? Are you going to need care in therapy? And it's hard for an individual consumer to forecast all of that.
Agreed.
And take on the role of signing up their own panel.
But if you're living in our community and you want to be treated by a local physician, you have the perfect facility to take this piece of paper or to take whomever you can contact with the PPO environment and allow your physician to be introduced to them.
Rob, are you seeing a lot of public input at your Tahoe Forest District meetings? Are you seeing folks show up and question you on this?
Frankly, we are seeing some input, but we're seeing more confusion than input.
Yeah.
And this is what caused us to radically change our approach as a hospital board. Originally, we started working on the development of a community health plan. We then realized, after doing some research, that one-size-fits-all health plan doesn't work in this community because many people work for large employers, and their health care is purchased by the employer in their headquarters city.
And they have no control.
We have a number of people in our community who work for government agencies. They're insured by PERS, or maybe it's a local agency who does make their decision.
Rob, it was probably a year ago, maybe even 2 years ago now, when we had some representatives from Tahoe Forest Hospital here talking about a managed health care program. Is there any progress on that?
Well, it's moving ahead. It's slower than anyone expected. We don't know at this time if it's going to move ahead or not. So I think what we're doing is doing our best on an information standpoint, not to rely on that as the savior or the salvation for this issue, but to get such good information into the community that people know which brokers to contact and they know what's available here. And right now, no one in the community has really taken on that consumer reports mentality. And frankly, John Falk and I are members of an ad hoc committee of the board, and our charge is to improve the communication of the community's health situation. And that consumer reports mentality is where we're headed.
Well, anybody can tell you that works in the public realm, it's very difficult to get out there and do the outreach when everybody in our community is working 2 or 3 jobs just to try to keep it together. Dr. Richards, I'd like to go back to you for a minute if I can. As being a part of the Independent Practice Association, the IPA, that is, perhaps let's take a step back. Explain to us what the IPA is and what the role of the IPA is.
If you don't have a corporate entity of physician practices, you are constricted against talking about your fees or contractual arrangements with payers of any sort amongst yourselves. There's just antitrust law that says that you cannot talk about your fees or contracts. And so, as part of community health planning, the hospital helped 4 years ago the physicians organize themselves, and the physicians saw fit to put together this corporate entity called an Independent Practice Association, we now call Tahoe IPA. Now, in that environment, you can come together to talk about the cost of healthcare. And so that's the basic purpose, is to actually improve access for the community. And while we've been in existence these 4 years, we have signed all the physicians, virtually all the physicians in the community, to a dozen new health plans that didn't exist here before. We've attempted to talk to health plans that had some smattering of physicians here to improve the patient's choice as to who they could go to all the doctors. And so we have contractual discussions with Blue Shield, with Blue Cross, with Foundation, and those entities that existed here before to try to give them more providers.
Has the IPA been working with Blue Shield then, or will Blue Shield work with the IPA in these discussions?
It's been a difficult situation. The IPA from its onset has contacted Blue Shield, attempted to bring them to negotiation, and they flatly refused to negotiate their rates at all. They don't want to talk to an IPA. They only want to affect individual
practices. Okay. Is the public welcome at IPA meetings?
No, it's a corporate board meeting. It's a private corporation, and so it's probably not the appropriate environment for public input.
It is a separate entity then from Tahoe Forest Hospital?
That's correct.
Okay. All right.
Could I ask Dr. Richards,
Karen, please.
if originally perhaps some of the doctors thought that maybe leaving the Blue Shield network because of the community health plan that was coming out was a viable option, if the community health plan is not maybe as near to being implemented as we originally thought maybe a year ago, does that at all make your decision difficult to continue with dropping the Blue Shield network? Maybe it's something we could renegotiate and not have a drop-dead date of December 1 or a specific date, and take it a 3-month or 6-month period at a time to say some of the factors we thought that were going to be coming out, so that when we drop Blue Shield there would be an alternative, haven't been in place yet. So maybe dropping the Blue Shield network as quickly as you had wanted to isn't viable without that many options available to the community to go to.
If I could respond to that, there's really nothing that the IPA can do about that relationship between Blue Shield and individual practices. These are contracts that pre-exist the IPA. And for whatever reason that an individual practice or an individual doctor will decide whether or not to continue that contractual arrangement where the company, Blue Shield, decides unilaterally without negotiation what that doctor will get paid, that's a separate business decision that we have no influence over. Now, the existence of the IPA and the movement towards a community health plan and those other strategies where we improve access and payers mix in the community, sure, we would like to see that work, but it doesn't really affect the individual practice's decision of whether to stay or not. Now, the IPA is probably going to ask its physicians independently, will you consider staying with Blue Shield just a little while longer? But we don't have a lot of business doing that, and that might not be a proper thing to do. But I agree with you that if we could go through a period of time when people would have some flexibility, research their options, and whether or not we will have that influence, it's beyond our purview. We can't really tell a physician to contract or not. On the other hand, we would like to contract with Blue Shield.
Okay, let's talk about options for a minute. This is a word that's come up a couple of times. You've talked about HMOs and PPOs, and maybe briefly we can define the difference. But first of all, what are the options? If so many people here are covered by Blue Shield and can no longer see the physician of their choice, and perhaps many other physicians that they might need secondary care from, is driving to Reno going to be the next choice for these people? Are they going to be basically uninsured and maybe in that case not get the medical care they need?
I think instead of being uninsured, you have to identify that they would become off-network before they're uninsured. They're still insured by Blue Shield. It's just that their network may no longer be solid. So they can still see any of the doctors, but they would be off-network. Therefore, a reimbursement would be even less from Blue Shield. And then the patient or the consumer would be responsible for more of the billing. Okay, I personally feel, and I think the office I work in feels that health insurance is a very personal choice. And again, we educate our people. We try to explain your different options. If Blue Shield's no longer a viable network, here's what you can do. Yes, you can access the Blue Card program in Reno. Yes, you can still see your favorite doctor in town, but this is what your ramifications or your costs would be. You're certainly able to qualify for Cal Farm if you're healthy, or a foundation or Blue Cross, or seek an alternative plan, but this is what it would pay out for you. It would either cost more or you would get less, or, you know, those kinds of options. And I think contacting a broker for some information, contacting your health plan directly for some education and information is key to figuring out what your options are.
Or perhaps if you are one of the employees of a larger organization, contacting a benefits administrator.
Always.
Rob, you had a comment on that?
Well, I think it's important to know a lot of people in our community are already driving to Reno or Sacramento for health care. And when we got into the community health planning, we found there are many people who live here that are retired, and they're members of Kaiser. And there is no Kaiser availability here. They have to go down to Roseville or Sacramento. There are many people who already are driving to Reno. So I don't think it's someplace we're going. I think we're already there, and we're already in a bit of a crisis. And especially for the people who are driving for health care, the crisis is here for them.
So what are we telling these people? I mean, really, frankly, what are we saying to people who cannot afford to pay for some other insurance? For instance, if my employer provides Blue Shield and I can't afford to pay $500 a month to somebody else for some kind of coverage, what am I being told? Am I being told to go to Reno? Am I being told to grin and bear it? Am I being told that I should only go see a doctor if I have a broken leg?
Well, I think maybe where we're feeling the void again in the Blue Shield network, it's particular specialties, Maya, that are no longer contracted. And in some cases, you do have access to a Blue Shield provider outside this area. There are providers who are actually based in South Lake Tahoe who may practice an incline 2 days a week or on a limited schedule, who are still contracted with Blue Shield. So you still can use the plan benefits the way they were structured and maximize your premium dollar how you're paying for the plan. In an employer's case, what some of the employers in the community have said is it's very difficult to take someone who could be treated locally, one of their employees, and now say when they would give them 2 hours off to be treated for whatever purpose, now they have to give them the whole day off or the half of the day off because they're either traveling to Reno or traveling to South Lake Tahoe. So it's a grind for the employer also to be able to say, well, you know, I have to change my work schedule or your particular department in order to let you have this time.
Right.
So, but yet the employer is paying for the plan too. He wants the employee to be able to get the maximum benefit. So.
Chris, if we are really truly in a crisis state right now with the insurance providers, and I'm not sure personally where we really stand on that. I know what I've read in the paper, I know what I'm hearing today, but what is the IPA's stance on this, and what sort of solutions is the IPA discussing?
As I've alluded to before, the IPA would like to have a contractual arrangement with Blue Shield. If Blue Shield would come and negotiate, I believe that we could work something out. We don't think that Blue Shield is any better or any worse than other insurance companies. We're happy to contract with them. We can provide the entire panel of physicians in the community to all the employers that care to buy Blue Shield, if Blue Shield would come and talk to us.
But Blue Shield talking to an organization is a historic precedent they don't want to set, is that correct? I mean,
I think that's probably part of it. Unfortunately, we don't have Blue Shield here to ask, but
Right.
I think that that's one of their worries.
okay.
At this point, do we have intervention between Blue Shield and the IPA from the Federal Trade Commission, if I remember the paper? Hopefully they're going to come in and help resolve some of your issues and guide you guys towards some better resolve.
I don't think we
and
can
answer
count
some
on the
questions.
federal government to resolve anything.
Thank you, Rob. That
Solution
was
maybe,
actually
right.
We are certainly not counting on them doing anything in terms of resolution, and what we've seen so far is that isn't their goal. So, no, speaking as one hospital board member, I don't think that's even a likely outcome from the FTC.
So what are we really telling the folks that are watching the show, though? What do we do? Do we go to Tahoe Forest Hospital for information? We go to our brokers and try to discover what some of the alternatives
the
are?
alternatives
Talk
are,
to our
right.
physician about other plans that they do accept, perhaps, and then go back to our broker and say, well, my doctor takes this.
Right.
What will this cost
Right.
me?
Right. Well, and that's one of the pieces that, that my two neighbors here on either side of me have is I've been working with Rob on a communication piece from the hospital basically that shows the plans, shows where the IPA is contracted, shows where the hospital is contracted, and then allows the broker community to actually access the plan if we need to, if it's not something we're already doing. In some cases, the miscommunication in the marketplace is the physicians are contracted, let's say, with the hometown health plan, but people think they can actually buy that particular insurance product, and you can't buy it here unless you're a Nevada resident because it's their proprietary product, but yet they actually have a PPO plan or PPO network with the IPA being contracted. So it's kind of interesting working on all levels trying to have a written piece or even more than one written piece that will allow the consumer to be able to have access to that information. So
There's a lot to know.
there is a lot to
There's a
know.
lot
And,
to
and
know.
there also, unfortunately, managed care has its own proprietary acronyms, and I think becoming familiar is part of the education process with that too, so people know what a PPO is and an
The
HMO.
alphabet soup.
Yeah, absolutely.
It starts to feel the IPA, the PPO, the HMO.
Right.
Where are we? First
Right.
of all,
Sounds
and
like a
maybe-
song from a 70s musical.
Well, and you and I are dating ourselves to be able to admit that too. I might admit.
You know, there is a hotline that the hospital has, and I'd like to give that number out.
Please, thank you.
Our Director of Community Information is monitoring that hotline, and there's always a message on it saying what's happened, if we have any late news. And people can also request information in the mail by leaving their address, and that number is 582-6340. Again, 582-6340. If you call and ask for information today, what you'll get is one page. It kind of summarizes what plans are available. Well, as Carolyn mentioned, where we're headed is to get more detailed information available so that we can show exactly which doctors accept which plan and which brokers sell which plan, and kind of from the Consumer Reports model.
Do we have anything on the web, anything online? that
Not
we
yet,
can
but I
access?
think Joseph's got that in his plans,
Okay.
and we're hoping the keyboard's flying away as we speak.
All right. Chris, give me some light at the end of the tunnel. Tell me what we can be looking forward to. It sounds right now like we're still in the information gathering stage, and people really still need to be in close contact with their physician, with their insurance broker, with the hospital on this.
It's real hard to say where we're headed. If we're going to pay our physicians less for what they do, what will that do to medical practice? What will that do to the doctor-patient relationship? I think if you want to pay your doctor less, that might influence your relationship in a way that we see in other communities, and we're a little bit nervous about. We think that having the payer come into the exam room, so to speak, and influence those decisions has not been accepted very well across the country, and we have a lot of anguish going on, and it is a national issue. I don't believe it's a local Truckee issue. How healthcare is paid for, what we decide to do as a society for the health of our citizens is really a national debate. So we're trying to hang in there and do the best we can and provide what we know best to be good medical care, and try to work with the political lay of the land and how insurance is perceived and utilized and how healthcare services are paid for. So we're keeping our ear open and keeping our options open. And we're very much attuned to access for local community members, however they want to pay for their medical care. We're trying to find solutions.
Okay. This isn't the first time, really, that insurance as an issue between healthcare and the patient has come up. There's been many instances of people not feeling that they've had enough care, for instance, not enough time in the hospital because their health plan mandated that they're in and out in the same day for that particular procedure, whether or not it was right or appropriate for that patient's circumstances. So this isn't really the first time that we've had people uncomfortable or unhappy with their insurance coverage or their insurance coverage relating to their physician. But I believe that, and I think people feel very disenfranchised from the whole process. They don't know enough about what it is that all of you do to be able to ask the right questions. And I think it's helpful to have access to communication such as what Tahoe Forest Hospital is providing. And that's just one step. People really do have to learn to talk to their broker, learn to talk to their employer, learn to talk to their physician. And that's not always an easy task.
And Maya, this may seem strange, but you're right, access is the issue. Many communities our size don't have a hospital, don't have the quality physicians that we have, and don't have the kind of medical equipment which is available both in those physicians' offices and in the hospital. You know, it is amazing just how many really state-of-the-art procedures can be done with the local physicians and in our local hospital. And many rural places just don't have that. So, frankly, I think we're ahead of many of the other places about our size, but access is the issue, and I think what you're hearing today is that we're all working on it, but from the beginning, 5-6 years ago, our approach has had to evolve because we've hit roadblocks at many different places, so we're all still learning as fast as we can.
Sure, I think as a citizen or as a local of Truckee, I feel very confident that if I had to get taken to Tahoe Forest for care, that I'd get excellent care. My concern would be when I get out. What happens to my economic status after
I mean, when
that.
you hit the billing office.
Exactly, exactly.
I also have prepared a series of questions that I use with a lot of the clients who come in my office, specific questions relating to each or every insurance plan, things that you should know before you sign on the dotted line, which of course is an insurance contract we require you to do. But that is something I'd be happy to supply with Rob. He and I haven't gotten that far in our conversations, but there are specific questions that I think if people knew them, they could ask the broker, the doctor, whomever may be involved in that decision-making process for them.
Okay, so really what we're asking people to do is go out and get more information. There just isn't enough right now to make your choice based on one small port. You really have to go out and get information.
Rob, is Tahoe Forest Hospital and the IPA two separate associations? Because it seems like a lot of the information that's brought out from the hospital seems to be linked with the IPA, and maybe it's important for the community to understand that there's a definite hospital relationship with doctors, but that you are, or maybe I'm wrong, maybe you are in the same type of organization, but aren't you a separate?
We are a government entity, and we provide a care setting in which the physicians can work for procedures that can't be done in their office. We don't, in most cases, employ physicians.
And your relationship with Blue Shield has been more solid than the individual doctors.
It has to do with their reimbursement for hospitals. Their reimbursement for hospitals is very fair. It's my opinion personally that their reimbursement for physicians is truly substandard. And frankly, I'm surprised that physicians have accepted that level of reimbursement for as long as they have. So we were just all hoping that it would continue until we had reasonable options in place. And many of us have been squeezed in between and just haven't had that happen.
Okay.
But the hospital is different from the IPA.
All right, and then we really do need to wrap this up. And Chris, I'd like to give you kind of the last word here if I can. Is there anything else that you'd like to add to the conversation today?
Well, I just want to support the idea of accessing information, and I do heartily recommend that people take another step and look at what does insurance mean to me? What am I buying when I buy insurance?
Right.
Is my plan being fair to the people that I want to see? People can talk to not only the hospital, the doctors, and their insurance broker. They can call up their insurance company, or they can vote with their wallet. You know, they can decide which, do they want to go somewhere else if their providers aren't local, or do they want to stay local? They can have some influence at the insurer's level. get to the table with these physicians and make us a deal we can live with.
Okay. Unfortunately, what we didn't get to today, and I didn't expect to, was any kind of magic panacea. But I really appreciate all of the input from our panelists today. It was very educational. And again, a good reminder to all of us to get out there, talk with your physician, your insurance broker, your employer, if they're a benefits provider, and also with Tahoe Forest Hospital. They're a good resource for information. We'll look forward, Rob, to seeing more information come out of Tahoe Forest, and hopefully eventually some word about the managed
But
healthcare
not just
plan.
out of us. We're all working together to put the information in
Great.
place.
Great, thank you. Okay, and thank you, all of you, for being on the show today.
Thank you.
It was my
Thank
pleasure
you,
to have
Maya.
you here. Thank you for joining us on Truckee Talks, and we'll see you next time.